that, Ajane, please explain House Concurrent Resolution 2056.
Madam Chair, members, House Concurrent Resolution 2056 proposes a constitutional amendment to establish a fundamental right for individuals to refuse medical mandates. It prohibits government entities from mandating, requiring, coercing, or compelling an individual to administer, accept, or receive any medical product or treatment as a condition of employment, education, access to public facilities, participation in services, or the exercise of any right or benefit in outlines exceptions. The Secretary of State must submit this proposition to the voters at the next general election. Madam Chair, there is one amendment that I can explain.
Please.
Madam Chair, members, the Cupper Amendment dated February 12, 2026 at 12:22 p.m. clarifies that this does not limit a special healthcare district from requiring its employees, contractors, or agents to comply with health and safety protocols necessary for patient protection or disease prevention, including personal protective equipment such as masks.
And we get kind of pissed off, and we say, well, we're going to do the opposite of what you say anyway. I think this is a win for vaccine uptake.
Other questions? Seeing none, we'll bring up our next speaker.
Zaid Fadul.
Evening, everybody. I appreciate everybody still being here and being chipper and energetic. I'm Dr. Zaid Fadul. I am a local family physician, a proud father of 4. I am a flight surgeon. I also serve in the Air Force Reserves. And I'm here on behalf of the Maricopa County Medical Society. I don't know how many other physicians have been testifying today, but it's been fascinating watching this legislative body for the first time. I am here in respectful opposition to the HCR 2056. I have a couple concerns, namely that it's very broad in terms of defining the spaces. And when you have all of these public spaces that could be determined by this bill and the access to it, you lose that clarity, and you end up encouraging a lot of people to, for lack of a better term, resist. I don't want to be told that I can't go to a park. I don't want to be told that I can't go to a train station or something else like that, and I don't want somebody in my business. I understand that urge. The problem is if there is an emergency, and I would argue there is one right now with the measles outbreak that's occurring all over the country, we lose the tools of containment. And I very much hold dear the constitutional rights of freedom of choice and doing those things, but there are those moments where as a society we have to come together to try and limit and protect the rest. I don't serve in the military because I think it's the coolest thing ever, although I do. I serve because I want to protect everybody's rights. And I choose that service over being with my family on the weekends. And when I deployed, I had to leave them all for months, and it was terrible. But I do it to protect everyone's rights. And I don't just pick a handful of people, and I'm really concerned that this bill would prioritize a handful of people's God-given rights at the expense of other people's rights. And that is my concern. I'm happy to take any questions.
Members, any questions?
Madam Chair.
All right, I think I heard.
Go ahead. No,
She's
go ahead.
deferring. Okay, back to Rep. Ligori.
I was trying to be quicker.
We were both really quick.
Thanks, Madam Chair. Thanks, Dr. Fadul. Am I saying that correctly?
Yes, ma'am.
So we had these conversations last year about this time in this committee. And I remember, reading the news, and it was like, there's one measles case reported here, and then the next week it would be like there's 4, and then there's 20, and then a child died, and now I think and so my question is, in over the past year, and now seeing that, measles might again be endemic in the United States, you spoke about during an outbreak, and so what I'd like to ask you is, elaborating on it, in an outbreak, public health officials have to move very fast. So how might this measure impede timely responses to that, and then what would that look like on the ground?
Madam Chair, Representative, the challenge with measles specifically is that it is so contagious that 90% of people coming in contact with it who are unvaccinated will pick it up. COVID had like a 10% infectivity rate. So, I mean, this is much, much worse. In addition, if you're coming in contact with the air that somebody breathed 2 hours later, you can still pick it up. And so the question becomes, how do you control that? For patients, you have to put them in a negative pressure room so that it sucks the air out, essentially filters it so somebody can be in that environment and limit the risk. You have to respond very, very quickly, and I think this bill would really handcuff that response time. You're looking at 4 days before somebody shows symptoms. 4 days. If I was to get on a plane and I had the symptom, and I didn't have symptoms, I could travel around the world multiple times over and stop in a variety of different environments in those same 4 days, and I could spread this, just like that. It was an incredibly monumental achievement to eradicate this in 2000. We are losing our elimination status. It's just a matter of a vote from the organization that governs this in April. So it's coming. We have 900 kids right now in South Carolina. They had to shut the school down. The reality is that could have been much, much better controlled if either there was higher vaccination rates or they were able to recognize and move quickly, and they weren't, and there were still 900 kids, of which likely 1 to 3 will die. Eminently preventable death of those children. I don't think anybody should feel good about that. I don't think anybody does. I think everybody here has a genuine interest to support the community. I really feel that. But the reality is that public health means you have to weigh these rights. And if I have to shut down parks in order to keep kids from congregating because of the low vaccination rates, and by low I mean less than 95%, that's what it takes for measles to spread. It's less than 95. 92% is where we're at as a country right now, which means 300,000 kids are at risk of getting measles today in the US. 2,500 could die from that. I just want to put that in context. If we get down to like 85%, 80%, that's my concern here, is that people will feel like, oh, this is okay if I back off. And then if a public health official like myself tries to come in and say, listen, wait, we have to limit access to churches, parks, or something, church is not the right answer, sorry. But parks or schools or other environments, it's going to create a lot of hostility and animosity. But I don't want to limit anybody's access to anything. But the reality is I want to protect people's children.
Thank you, Madam Chair. Just one more question.
Sure.
Along those lines, so in limiting the state's ability, again, in requiring certain vaccines in schools, I think we've talked about how quickly it could spread, across the country and with children, but also in infants who are too young to be fully vaccinated, who don't have a choice, and family members who don't have a choice. That's not really a question, more of a statement, but if you have any thoughts on that, I'd love to hear the vulnerable side of this, of parents who might make different decisions one way or another, but whose kids are too young, and then also very susceptible to getting sick.
Madam
Dr.
Chair,
Fadul,
Representative.
yes.
Yeah, if you guys will indulge me. So typically kids get vaccinated at 12 to 15 months, specifically for measles, mumps, and rubella. So I have a 20-month-old at home. I think your kid's a little older than mine. But inevitably, they can't get that vaccine below 6 months. And so, it presents a situation, because I've got 2 others in the house that are going to school. One is just under 4 years old, so he still hasn't got a second dose yet. And so he can easily bring it home if there's an outbreak in Arizona. So anybody whose child is under 6 months unequivocally is vulnerable. And so they're not even at a choice where they get to choose. Anybody who is only had 1 dose of the vaccine, it's a 93% protective rate, but you still have those kids who can have gotten the vaccine and still not be able to do it. You have moms who are growing up now unvaccinated, and they're getting to the point of pregnancy and they're carrying. Their babies are at risk. Those unborn children, we have to do everything we can to protect them. I think that's a universally shared feeling here. You've got death rate for the mothers, as well as miscarriage rates, as well as pneumonia that can be quite harmful. There's a slew of complications. You've got people who get older and their immune system starts to wane. And those, everybody is touched by this. It's not just people who get, unvaccinated. It's people who are vaccinated. If somebody develops HIV, it's a human immunodeficiency virus. Their immune system is not competent and capable. And they could have gotten vaccinated when they were younger, and they've just lost that ability. People who suffered from COVID, they've had significant, impacts on their immune system. So there's a lot of people out there who mean well and didn't make that choice that are going to be impacted. That's the problem. When you have a virus that is so aggressive and so effective at infecting every gap in coverage, it's going to find everybody it can, and it's going to infect them, and there's going to be a lot of complications from it.
Thank you, Madam Chair. And that's just one of them, that we're talking about, measles. Yeah.
Yes.
All right, Rep. Cupper, you're next.
Thank you. Doctor, good talking to you earlier.
Sure.
I'm glad you were able to make it back. Did you just sign off to the airport all right?
I did, yes.
Okay, thank you. Are you aware of how many children have died of measles in the past 20, 30 years?
Yes, sir.
How many?
2.
2. Okay. And Madam Chair, to be clear, you said it could be 25,000, but 2 have died in the past 20 plus years?
Dr.
Yes.
Fadul.
Madam, may I elaborate on this?
Yeah, because I think where you're going to go is because there's an increased population with measles, it's probably proportionally the death rate. Okay, but you'd say it in your words. I don't have numbers in here.
All right, if I don't trip over my words, it's like this. In 2000, we had a handful of circulating cases. Typically, it's from people traveling abroad, bringing it in, and then you might see one here, one there, and it's not a big deal. With vaccination rates declining steadily, and you make an excellent point. I looked it up. I was shocked when I realized how much of an impact COVID had, and frankly, the mismanagement of the, I mean, you and I both very much agree on this, but it didn't start with COVID. Vaccination rates have steadily been going down since the 2010, 2015 era, very directly in line with social media. And I would posit that a lot of the misinformation, what ends up happening is you see people that all of a sudden hesitate. And they start to hold back. And then you had the mismanagement of the COVID situation, and everybody felt like, wait a minute, this is, frankly, this is unsettling. And it's been steadily dropping ever since then. I saw a study, I looked it up earlier today, that said typically people exposed to vaccine misinformation online have a 2% lower uptake rate. And so they just hesitate, with good reason. If I thought people were, injecting me with aluminum, I would question, like, what in the world am I getting aluminum in my body for, without understanding it's an adjuvant. So today versus 25 years ago, you did not have nearly the population, the fertile grounds for the vaccines or for the measles to explode. So I think that's why we had 2. But I would look at it differently than saying 2 over 25 years. I'd say 2 in the last year versus 0 for the 24 years before that.
And Madam,
that's more my concern.
not to interrupt you, I just had it to that point.
Yeah, okay. Is that okay?
To the point, go ahead.
Okay,
Yeah.
to that point.
To the point, according to the CDC, there's been 3 confirmed deaths just in the last year. So,
Yes, ma'am, but it's 2 children.
2 children,
Well, I
3
can speak on
total.
that.
All right, Rep. Cupper, you're next.
Thank you. It is 3. However, the thing is, one of them got measles when they were an infant before they could ever have a vaccine, and
Yeah.
it was roughly 10 years before last year when they first got it. It was delayed onset, and then they died from a very rare scenario. So technically, they died of measles last year.
SSPE?
I don't recall the name. Additionally, though, from what I've been able to research, there was one death in 2003 from measles. It was a severely immunocompromised person who had gotten it in Mexico. Child, again, these are children. And before that, there were 3 in 1992 during an outbreak in Texas, Kentucky, and Alaska. All that to say, though, I want to push back on one thing you said, at least for Arizona. I don't know if you were pulling different data, but you said that things started dropping in 2010. According to NIS, in Arizona, the MMR shot alone kept a 90 or 91% rate of vaccination for children aged 19 to 35 months. It maintained that rate all the way until 2020. And then it was 88%, 86%, 85%, 84%, 83% last year. When you go overly heavily handed, the data is there. When we added in our exemptions to this state, the data didn't drop. But when you did it for COVID and we overly mandated things, you started seeing reductions. I am fully convinced that what I am running here will reverse that trend.
Dr. Fadul, would you like to offer a comment?
Would, madam. I would say that it's actually on this body to lead. And I was part of the COVID response for Luke and the cancer hospital that I was running at the time. And there was a lot of mixed messaging out there. I did not appreciate the mixed messaging, both from the CDC, from Fauci, and from President Trump at the time. And it made it extremely difficult. I did not appreciate the fear-mongering that I came across from social media. I did not appreciate the lack of cohesive message. And so when you have leaders that are themselves not agreeing with the right way forward, people have a tendency to pause, and that's why we're not allowed to yell fire in a movie theater, because if you've got a bunch of people going in different directions and nobody knows what's really wrong, you get a stampede and people get trampled. I would challenge this body, frankly, to lead. We are one of the few states, I think there's 11 states that offer very easy access to exemptions, more than just medical. And our rates are lower than the rest of the country. And we've had 3 cases in the last couple of weeks of measles here at Phoenix Sky Harbor just a couple days ago, I think. And I think we have the opportunity in this state to say, look, we very much believe in medical autonomy. I do. I don't want anybody to tell me what to do. but I also respect the overall rights of the community that I serve. And I think that's the message that should break through, that we do respect here. This is a constitutional carry state. I still went out and got my concealed license because I wanted to make sure that I was fully educated, and I can't say that a lot of people have the time or the wherewithal to really fully educate themselves on the risks. That's my actual fear, is a lack of rational choices and the harm that stems from that comes after.
Madam Chair, one final question.
Please.
Thank you. And thank you for staying up here and like I said, being so late. I appreciate it. Is there anything, to the best of your knowledge from you reading this bill, is there anything in this bill that prevents the state or schools or any subdivision of us from making any medical product free, easily available, to educating people from, if we need to provide a slightly different facility for somebody, is there anything in this that stops that from happening?
Madam, I would say explicitly no.
Thank you.
Any other questions? All right, next speaker.
Thank you guys for your time.